Hello, good afternoon, good morning, good evening, everyone. Welcome to today's EPIWIN webinar. We'll just start very soon, waiting a couple of minutes to let everyone join. Good morning, good afternoon, good evening. Welcome to today's WHO EPIWIN webinar. Our topic today is WHO Infection Prevention and Control, that's IPC, and Water and Sanitation and Hygiene in Health Emergency Readiness for Response, Operations Capabilities Checklist. I know that's a bit long, but it's a very important topic and something that many of you who are in the field cannot do without. So we're launching the global checklist today through this EPIWIN webinar, and we have some very important speakers who can help you tell you how to use this checklist, as well as some practical examples from 2 countries. Before we go to that, though, I'd like to welcome all of you, especially those of you living far away where it's really early in the morning or late at night. We really appreciate your being here. Thank you very much. For those of you who are familiar to EPIWIN, you already know we love to hear from you. So please introduce yourself in the chat and where you're from and what you do. And of course, we love to hear from you. So any insights, examples, experiences you want to share, please do share it on the chat. We do read the chat and we do take notice of what you're saying. So it's really great if we can hear from you. But if you have questions, it's easier for us to keep track of questions if you write it in the Q&A. So I request all of you to write any questions you have in the Q&A box. And our experts today will do their best to answer it. We also, as usual, have a Q&A session at the end of the webinar where we try and answer as many questions as possible. I'm Supriya Besbara. As many of you know, I lead on EPIWIN Science and Knowledge Translation. And I've been doing this for the last more than 2 years. I'd like to introduce our speakers for today. We have Dr. Janet Diaz, who's the WHO Unit Head for Safe and Scalable Care. She'll provide the opening remarks. Then April Baller, who's the team lead for IPC and WASH, will provide an overview of the framework and the toolkit. Then we have Mahmoud Hamouda, who's the Health Systems Officer, who'll introduce the checklist to you. You know, the purpose, the components, how to use it, everything you want to know there. But if you need to know how it's actually used at the countries, we have 2 countries, Rwanda and Sierra Leone. We have Alphonsine Mukamunana, who's the Environment Health Specialist from the Ministry of Health in Rwanda. And then we have Bobson Fofana, who's the IPC officer in the WHO country office in Sierra Leone. It will, I think, give you a good overview of how to use this checklist, and I hope after this you will use this checklist. We also have the links. We share the links with you so you can access the checklist as well. Then for your questions, though, we have 2 eminent persons moderating the Q&A. Omar El Khattab, Senior Advisor for WASH in UNICEF, and Anthony Twyman, who's the UK Public Health Rapid Support Team. Finally, after that, Janet will again wrap up with the concluding remarks for this session. And then I'll come back to let you know what you have next week. Before I hand over to Janet, I just want to say that it's wonderful to have all of you here as the EPIWIN family, but we would like to keep, while we love to hear from you, we would like you to keep all your comments respectful and constructive and positive, and relevant to the topic. We're very lucky that we've rarely had anything disrespectful, but if there is one, we will not, we will then have to let you out of the webinar. But we look forward to your positive comments, most definitely. Then with this exciting panel, I will not keep you waiting any longer. Over to Janet Diaz, Unit Head for Safe and Scalable Care in WHO headquarters. Over to you, Janet.
Thank you so much, Supriya, and good morning, good afternoon, and good evening, colleagues joining us from all over the world. It is my great pleasure and honor to welcome you to this EPIWIN webinar for the global launch of the WHO Infection Prevention and Control, IPC, and Water, Sanitation, and Hygiene, WASH, and Health Emergency Readiness for Response Operations Capabilities Checklist. Again, a little bit long, but we do have a shorter name. It's called the IPC and WASH Hero CAPE. As we all know, infectious disease outbreaks continue to challenge health systems, particularly in resource-limited and humanitarian settings. Providing safe and scalable care during health emergencies requires high-quality clinical management of patients and ensures the safety of everyone caring for them. Healthcare services are critical, ensuring the best outcomes for patients throughout the life cycle of health emergencies, and especially when responses require rapid scale-up of clinical capacity. In these circumstances, care delivery systems must protect against the risk of increased adverse events among service providers and users. This is why strengthening infection prevention and control measures and water, sanitation, and hygiene services is fundamental, not only for effective outbreak response to prevent amplification of outbreaks within health facilities, but also during the provision of routine, regular healthcare delivery. Today, WHO is launching the IPC and WASH Hero CAPE Checklist, a practical new tool to strengthen IPC and WASH national, subnational readiness capabilities to respond to public health emergencies. The checklist is grounded in the WHO IPC framework and toolkit for outbreak preparedness, readiness, and response at the national level. It is designed to help countries and partners assess and enhance readiness capabilities across the health system, with emphasis on real-time implementation, coordination, and frontline capacity. Importantly, the tool is available both in digital and offline formats, making it adaptable to different contexts. This session will introduce you to the tool and provide implementation perspectives from colleagues in Rwanda and Sierra Leone who've actually applied the HERO checklist during various emergency phases. Their insights will facilitate better understanding of the practical benefits for patients, health and care workers, and of course, highlight challenges and opportunities for its use. With that, let me thank all the speakers in advance, country colleagues, and partners for their collaboration in this work. It is actually due to this type of collective effort that we are able to deliver on such products. I will now hand over to Supriya, who's going to do a quick Slido, and then to my colleague, our first speaker, Dr. April Beller, the team lead of IPC and WASH and health emergencies, who will provide the overview for the IPC framework and toolkit for outbreak preparedness, readiness, and response. Over to you.
Thank you very much, Janet. As usual, before we start the technical session, we love to hear from all of you. So today's Slido question is, what are the top 2 IPC and WASH capabilities required in the context of an outbreak at the national level? So join us at slido.com, #1325154. That's 1325154. We have the options: coordination, guidelines, SOPs, training, assessment, readiness plans, and surveillance. So come on, we only have 3 people so far. We'd like to hear from more of you. Slido.com, #1325154. Great. There are now a few more of you. And it looks like most of you think it's coordination and guidelines and SOPs. Okay, guidelines and SOPs, top 2 IPC and WASH capabilities required. Followed by coordination. And we have 95 of you, 98 of you, 100. Come on. Right? Okay, in the interest of time, I will stop here. It looks like most of you think it's guidelines and SOPs for, and the second is coordination, the top 2 required in the context of outbreak at national level. I will leave this open, slido.com, hashtag 1325154. I'll leave it open till the end of the webinar, so please keep your responses coming, and I will share this with the panelists at the end so they know what you think. Thank you very much. And with that, I'd like to invite April Bala, team lead for IPC and WASH at headquarters, WHO headquarters here, to talk to us about the framework. Over to you, April.
Thank you so much, Supriya. Can you confirm you can see this, the slides?
Yes, we can see it.
Okay, great. So warm welcome once again. Thanks to everyone for joining. It's great to see so many. I think we have over 700, so really appreciate people taking time. My name is April Baller, and I lead the IPC and WASH team within the health emergency based in Geneva. So it's my pleasure today. I'm going to speak about the framework and toolkit for outbreak preparedness, readiness, and response. So first of all, what is the issue and what is the problem? The issue that we're having and have had and actually continue to have despite having lots of experience is that we need to be better prepared for future threats. This is particularly important within the context of the IPC community, but also the wider public health community. And that's what we're going to be looking at today. And that's what this tool and framework is about. And one thing just to highlight here is that this is an iterative process. And even though we are learning each time, there's always something new and lessons to be learned and recommendations. So it's a continuous improvement cycle. So with that, what happens in the context of outbreaks? Outbreaks start in the community. The individuals who feel sick will go to the health facility. Within the health facility, if the IPC measures and the WASH services are not in place, there can occur transmission within the health facility, which is known as healthcare-associated infections, and also known as nosocomial infections. And then in the worst-case scenario, this transmission will continue back into the community as individuals and patients are discharged or if they leave. And then it can amplify and cross borders, as we saw very much in COVID. And one example just wanted to share here with colleagues is the example which highlighted this very explicitly during the Democratic Republic of Congo Ebola outbreak, which took place from 2018 to 2020. And what you can see here on this graph or this figure is the gray is the number of community cases of Ebola, and the ones in dark blue are the nosocomial infections occurring in patients and visitors. And the proportion between these two varies depending on the phase of the outbreak. And importantly, during the first 2 periods of the outbreak, the highest number of cases occurred in the community. But then at the tail end of the outbreak, there was more infections occurring within the health facility, and this actually led to the prolongation of the outbreak, hence the importance of today's session. So high-level goals for IPC in the context of outbreaks is to reduce transmission of healthcare-associated infections, to enhance the safety of staff, all of you, to patients and visitors, and to enhance the ability of the facility and the local organization to be able to respond to the outbreaks. That includes the EOCs, the IMSTs, and finally, to reduce the risk of hospital or health facility amplification. So today, I'm going to share with you the framework and toolkit for IPC and outbreaks. What is it exactly? It is a package which includes two key elements. First is a practical framework of actions to strengthen IPC, and the second is a bundle of resources that can be used both at health facility level and at national level. And what you can see here on the right are the two documents. The one on the upper right, the white one, is the package to be used at national level, and then the light green one here is the one, the corresponding one, a complementary one for healthcare facility level. And what is the goal of it? The goal of it really is to prevent and control communicable disease outbreaks amplifying within health facilities as they're being managed. Now, an important point is that this framework is generalizable to outbreaks and pandemics, regardless of the pathogen. So you could use it for any type of pathogen, and also regardless of the route of transmission of that pathogen. So with that, what exactly is the framework? What is embedded within the framework? So there are 10 key IPC actions, and these are the same actions that are for national level and facility level. And what do they include? They are here. The important ones, which were already alluded to earlier in the silo, is around the coordination. Often we call this the IPC Outbreak Task Force, but it can also be the National IPC Committee, which is repurposed during outbreaks. It includes surge capacity. This is a key component, which is critical. Surge capacity for IPC during outbreaks. So what does that mean? It could be surge capacity in the context of finance, ensuring funding is available, readily available, human resources, repurposing health workers from their normal work to support the outbreaks, logistics, supplies, infrastructure, ensuring enhanced bed capacity, and then, and of course, supplies, particularly PPE, but also IPC and wash supplies. So these are some of the, these are some of these key activities. Now, in addition to that, the framework also speaks to the different phases of the emergencies. Preparedness, which is approximately considered from 2 years to 6 months prior to any threat occurring. Readiness phase, which is 6 months in advance to a defined threat. And then, of course, response is when there's a defined threat and responding to that. What is the difference? So you still have your 10 key activities. However, depending on what phase you're in, then you will work on them in different ways. So if it's around assessments, then you will be really looking at developing your assessment plans and your improvement plans. While if you're in the readiness phase, then you're already looking at adapting whatever threat there is. You want to adapt whatever you already have in place to that threat. So for example, IPC guidelines, you may have national IPC guidelines, and then you have a threat, for example, MPOX. So how do you then adapt those guidelines specifically to the threat at hand, MPOX, looking at the mode of transmission and the precautions required. And then finally, of course, during the response phase, it's about activation and executing the plan if you have that in place. So just to deep dive into one of those areas, we have the evaluation of IPC capacity, which is one key IPC activity. And within that, there is national level and at health facility. And our next speaker, Dr. Mahmoud, will be speaking to national level, particularly around the HERO, which is what we're here for today. But just wanted to highlight that at national level and at health facility level, once again, there are different types of tools to be used based on what phase of the emergency you're in, what's available, and what threat is at hand. And at the health facility, many of you here who are engaged with IPC will be very familiar with the IPCAF. Hopefully, there's also the minimum requirements assessment. These are used more in the preparedness and readiness phase. And why are they used then? They're more comprehensive, programmatic, and require some more time. However, if you're already in the middle of an outbreak and you need to do a rapid assessment, there are also tools available for that. Some of you will be aware of the scorecard, which is used for the Ebola, and the recently published one for Mpox. So those are just to highlight some of the different elements that are available and the tools that are and resources available with respect to evaluating IPC capacity. So in addition to the framework, it also is the package includes tools, and these are many available resources. So there is a whole different sections where you can go into the package and look at different tools which can help and facilitate the different things that based on the situation, the context that you're in, what you might need. So for example, if you need resources around standard and transmission-based precautions, those are available in that section. Then there are disease-specific resources. So it's really a wonderful, shall we say, almost like an electronic library. And finally, in addition to the framework and toolkit, there is now an implementation manual. So the toolkit and the framework is really what needs to be done. And the implementation manual is how to do that. And this has been developed and will be published within the next month or two, really based on feedback from the field where they're asking for a bit more guidance on the how to. And here on your right-hand side, you can see the different elements of that implementation manual. Importantly, it has country examples, which is always helpful. In addition to that, it talks about some of the barriers. And just to share finally that this implementation manual has been piloted. So we're also within WHO doing our own iterative continuous quality improvement process. And this was piloted in Ukraine, and we'll give a big shout out to our colleagues in Ukraine for facilitating that. And they identified in the readiness phase 2 high-threat pathogens, which were cholera and measles. And now they're in the process of develop their improvement plans and addressing that. They submitted an abstract to the upcoming international conference on prevention and control, infection control, the IPIC, which is occurring in Geneva from the 16th to 19th of September. So we encourage those of you that can to come to that. And if you do, please come and see this poster, which will be presented by our Ukraine colleagues. So with that, to conclude, epidemics can occur at any time. We do not know when the next one will take place. Advanced preparation protects health workers, patients, visitors, and health facilities, and mitigates outbreak amplification. And finally, this framework toolkit and the implementation manual are useful resources to enhance capabilities for safe and quality care in the context of public health emergencies. So thank you very much. And also thanks to the team behind the scenes for helping with the development of this presentation. And back to you, Supriya.
Thank you very much, April, for that overview of the framework. A very succinct and clear overview. Now, for actually letting you know how the checklist works, I invite Mahmoud. Over to you, Mahmoud Hamouda, Health Special Systems Officer for IPC and WASH at WHO.
Thank you so much, Supriya, and thank you so much, April, for this very comprehensive overview about the framework. So again, warm welcome to all our participants, and happy to be with you today. Just please confirm that you are seeing my slides.
Mahmoud, could you put them in presentation mode?
Yeah, 1 minute. Okay. So I'm Mahmoud Hamouda. I'm Health System Officer working with IPC and WASH team here based in HQ Geneva. And without any further ado, I will go straight forward to introduce the tool, to understand what is actually the tool, and overview about its structure, scoring system, and how best utilize and use the tool. So the tool was derived from the WHO framework and toolkit for IPC in outbreak preparedness, readiness, and response at national level, and also align with state party annual report system SPAR tool, SPAR report, and also with the health emergency framework. So it's a self-administrated tool to support the health official to evaluate the key functionality of IPC and WASH readiness capabilities at the national and subnational level. And when I say the readiness capability, I mean the activities which is structured in the framework, and also it's referred to the national system ability to respond effectively at time of response or at time of outbreaks. So it's aimed to strengthen the IPC operational readiness for response for public health threats. So why the use of IPC and WASH HeroCap checklist is important, because it's to enhance the readiness for imminent or recurrent public health threats, and also to assess the existing readiness capabilities, and also identifying the gaps, and based on the identified gaps, we can develop an improvement plan to monitor the progress. So as you all know, when the outbreaks comes, it's really challenging and test the system capability to respond effectively to this public health threats or any disease outbreaks. Who's the target user from the checklist? Ideally, the target user will be the national authorities, subnational authorities like Ministry of Health, national level CDC or Center of Disease Control, and also emergency operation centers, IPC and WASH focal point, and public health professional. This tool could be used jointly between involving the national team and partners as well, WHO, and other stakeholders. So as it was mentioned in the previous presentation, that there is key actions and activities need to be in place at the national, subnational level, and also at the health facility level. And it's very important to evaluate our capacity to know if we are ready or no to respond effectively to the outbreaks. One of these activities is to having a coordination mechanism in place, and also IPC readiness plans, surveillance system. Do you have a communication strategy in place, and also surge capacity if needed? Do we know the partners, implementing partners in our country, who's doing what and where? And also, we need to test our system and abilities. So quickly, the overview of the IPC and WASH HeroCap checklist. It's contained the capabilities, IPC and WASH capabilities, and under each capability, it's breakdown to sub-capabilities. So it's a structured closed format checklist. If we start with the capabilities, as I mentioned, the number one is the IPC and WASH coordination mechanism, which is important to be in place to oversight all the strategic, operational, and technical activities. And under the coordination mechanism, we are asking if you have a communication strategy, a platform, share the information, share the guideline, So this is very important also to be in place to standardize the practice during the response. And also asking about the IPC partners mapping. Do you have already mapped the partners in your country? Do you know who can respond, where and when and why? Also, under this coordination capability, we are asking if you have functional IPC stakeholders network already known and in place in case we need to mobilize resources and so on. Second capability is about the readiness plan. Do you have a contingency plan, a surge capacity plan, a responsive stockpiling process? When I say responsive, it means it's able to respond very fast during the response. So that's why it's need to be tested. Do you identify the priority health facility? Because at time of response to imminent public health threat, we will not expose the whole health system to response. Of course, the MOH authorities will designate some facilities to respond to this particular public health threat based on the risk assessment, based on the geographical distribution, based on many factors. So they will dedicate some facility or designate some facilities to handle this particular public health threat. So it's very important to identify them and very important later on to assess them readiness as well. I'm coming to this point in a minute. The third capability is about the IPC guideline policies standards for this particular public health threat or the disease outbreak. This should be in place. Again, it's needed to standardize the practice among the Ministry of Health, partner implementing partners and others. So we are asking about the national IPC guideline and WHOOsh standards for this public health threat. And also, do you have a distribution plan at the national level? The fourth one is about the training programs. So we are asking about the WHOOsh training program and curriculum material exist and available for this particular public health threat. Do you have active training program at the national level? Do you have the information, education, communication material like poster and other communication messages ready for this threat? The fifth one is about the assessment at the national, subnational capability or system. So we are asking if you have a system in place, including all the resources needed, the manpower, the standardized tool to conduct the assessment, all the resources needed to have this assessment should be in place. And also, as a sub-capability, we are asking about the simulation exercise. It's so important from time to time to test your ability to respond during the simulation exercise. And the last one on the sub-capabilities is about the completion of the IPC and WHOOsh assessment at the health facility, the priority and designated health facilities. So the last one is about the surveillance and reporting one, and the sub-capability around do you have an active coordination mechanism for data collection and reporting? Do you have a standardized tool for this priority public health threat? The case definition is already understood and the healthcare worker being trained on it. And also there is functional laboratory service supporting this. So I need you to think about the HeroCap tool as a dashboard where you can identify where we are stand today and what we need to strengthen for tomorrow in terms of IPC and WHOOsh. So the scoring system here, we are using the traffic light scoring system, and as you can see, we are using red, orange, yellow, light green, and a green, dark green, which is very similar to a SPAR as well. So what do we mean by not ready? If the capabilities score percent from 0 to 20, you will score it 1. This means the sub-capability is not in place. Score 2, minimally ready. This means that the sub-capabilities under the development, you start something, but you need to complete it, and it's not yet implemented, or you are lacking financial resources, technical resources, and so on. The partially ready means that the sub-capability exists and developed at the national level, but not yet cascaded to sub-national and to the designated health facility level. Mostly ready when the scoring from 60 to 80%, and this means that the capabilities, sub-capabilities are in place at the national, sub-national level, and among some of the designated health facilities. Completely ready means that the capabilities exist at the 3 levels, and there is no need for any external resources. So as I was saying that ideally this national checklist, the HERO checklist, goes very well to use the health facility tools to assess the readiness at the health facility tool. So as I was mentioned, in a scenario that you have an imminent threat, you need to designate and identify the priority health facility. You need to assess them using the appropriate assessment tool like IPCAF minimum requirement tool, WASH fit tool, or post together, or even integrated tool. And if you have a national assessment tool fit for purpose, please do and use it to assess this designated health facility as well. And also, if there is already published tool, rapid assessment tool, you can, for example, the one for Mpox, the one for Ebola and Marburg, it's also perfectly fit the purpose and it could be used. Then you will come to evaluate your national capabilities. You will score, as I mentioned, from 1 to 5 based on the findings. And by the way, we have already a user guide in the offline Excel sheet of this tool. And in the second slide, I also going to present how you can find it in the partners platform. And then when you identify and assess, evaluate the national capacities based on the identified gaps, you're going to develop your national improvement plan as well. And we're recommending to do this among with the partners and implementing partners. So it will provide real-time solutions as well. Then it's also recommended to conduct a follow-up assessment every 6 months or whenever there is a significant change in the situation. Ideally as well to integrate this assessment with the national plan, national readiness and preparedness plan. Actually, if you have the chance to use this tool to put the needed activities and action in your national plan, please do it. So this is the first scenario when you have a disease-specific or imminent public health threat. We have another scenario where you can use this checklist as general assessment for IPC and WASH capabilities. Quickly, this is the screenshots from the checklist. Here, this screenshot from the Excel offline version of the tool. First part is about the risk assessment. We are asking how many designated facilities have been identified, how many health facilities you already assessed and achieved the target scoring. And in the user guide, you will find out that we put some recommended achieving score like 80% if you are using the rapid assessment tool, 100% if you are using the IPCAF minimum requirement, and so on. In the Excel sheet version, also, as I mentioned, you will find the user guide. Detailed user guide will guide you how to score. And in the tool itself, you will find a column for any comments, notes, and also verifiers. The verifiers is very important, will help you to figure out the to figure out if you are scoring correctly, and the sum of evidence resources need to be seen, need to be in place to score it each subcapability in proper way. As I mentioned before, we are using the traffic light code, and easily you can pick up what's the capability are not ready, and what are the minimally ready and partially ready and mostly ready. And at the end of it, you will find a summary of scoring, as you can see, and also a graph can be presented. Again, this is very important for the decision makers, and you know, the figures and numbers speaks, and when you express about measurable things, you can track, and you can also request mobilization of resources whenever needed. Quickly, the IPC and WOSH HeroCap tool on the WHO Partners platform. And this, as a background for the Partners platform, was established at time of COVID 2020. The idea and objective from the Partners platform is to facilitate the resource mobilization, the coordination and collaboration with partners. So when you will find the HeroCap tool digitalized already and embedded in this platform. So as you can see, we'll identify the gaps, prioritize the action, and engage with the partners. So it's facilitate the direct engagement with the partners as well. On this platform, you will find different and many capability checklist, and you will find the Hero cross-cutting one, which is including 12 core capabilities, not only IPC, and also you will find our tool, which is a specific technical area for IPC and WOSH. You have two forms of the digital version: the general assessment one, and also the priority disease specific one, where you can activate each one as needed. So to navigate you through the partners platform, you need to log in and request access, and then you will find the our box here, the offline checklist and online checklist. Also, there is also useful links you can use for training videos, and also direct link to activate the disease-specific one. As you can see here, this is the IPC and WOSH HeroCap general assessment. You will click open, and when you open, you will see all the capabilities. For example, the number one capability is about the coordination. You can score each and every one. As you can see, a pop-up box will show you the scoring from 1 to 5, and also will guide you what the interpretation of each score. At the end, when you finish, you can press publish, and then you will select who can give the permission to see this checklist. When you identify the gaps and action, you can also prioritize them for scaling up each and every one. From the workplace, you can see here the published assessment tool. Thank you so much for this, and over to you, Supriya.
Thank you very much, Mahmoud, for that very comprehensive overview of the 6 capabilities and the scoring system and how to work on that. Thank you. And with that, now you've heard of the checklist, but in reality, you know what you should do, but how does it work in reality at the country level? We will hear about that. So I request Dr. Bobson Fofana, IPC officer in the WHO country office, to talk about the Sierra Leone experience of applying HERO for national IPC readiness and response to the Mpox outbreak. And for those of you on the participants, the partners platform that Mahmoud just showed is the link to that has also been shared by one of the participants. Thank you very much. Over to you, Bobson.
Yes, thank you very much. Good afternoon, good morning, everyone on this call. And I really appreciate the opportunity to share our experience in using this very important tool for assessing the IPC and WASH capabilities at the face of readiness and also any response. So our context is specifically for the Mpox outbreak in Sierra Leone. So my name is Bobson Fofana. I work for the WHO country office here in Sierra Leone. Next slide, please. So briefly, I will share with you the initial assessment that was done, which is within the readiness phase, and also post-assessment gaps that were identified and the actions that were taken based on the findings, but to also show you some important findings from the follow-up assessment that we did 6 months later. And finally, we share with you some key achievements and some lessons that we documented in using the tool. Next. So as I mentioned, this is a checklist that was used specifically in the first time at the response, the readiness phase of Mpox. So at the initial phase, we actually had, even before Mpox was we defined as readiness phase in Sierra Leone, we have had initial engagement with the HQ team and expressed interest. By then, the tool was in the pilot phase. So the national focal point in the Ministry of Health expressed interest in the use of the tool, anticipating that Sierra Leone is a country which is prone to numerous outbreaks, and tools like this can be very much useful. So that was last year in September, and we had a virtual session where Mahmoud also share instructions and guidance on the use of the tool. And after that, we did an assessment of health facilities. So per requirement of the tool, Mahmoud, I think already mentioned that you need to have a baseline form of assessment for healthcare facilities using any of the routines tool like the IPCAF. But for this one specifically, we decided to use the WHO Afro IPC WASH assessment, rapid assessment tool for Mpox specifically. So we did an assessment of 32 health facilities in Sierra Leone, and we got the results. So based on that findings, or based on that result, we went on to complete the HERO assessment tool. So we have to agree on dates, and the partners, like you said, involving partners is very much relevant for ownership, because at the end of the day, we expect partners to also come in terms of the implementation, funding support, logistics support. So we have to include them all the way throughout the initial planning on the use of the tool. So we had a joint meeting at the WHO office where we completed the assessment. And immediately after that, we completed the assessment in late December 2024. And the second week of January 2025, we recorded our first case of Mpox. So the picture you are seeing there is during the first, the healthcare facility assessment that we did in preparation for completion of the tool. Next slide. So this is the result from the assessment we conducted at the preparedness phase before we even at the readiness phase before we got the first case. So it cut across the 6 domains of capability domains that Mohammed speaks loudly about. And we got a result of about 59% overall, which positioned the country or the IPC program itself at partially ready in terms of responding to the Mpox outbreak. The result was not encouraging, and even during the process of the assessment with the national team and the partners, we had lots of argument, because some of the capabilities we thought we had were actually not even there at the time of the assessment. So we noted huge gap in terms of guidelines, specifically for Mpox, even though there has been different IPC guidelines that have been deployed in health facilities, but we noted a huge gap, or no other guideline were in existence to address issues of Mpox with regards to IPC and WASH. So we had performance there, 33%. And also the readiness plan also was never there, 60%. But also we look at things like the surveillance capacity assessment and also the coordination mechanism. We also noted gap. So on overall, for the initial assessment, based on the scale of rating from 1 to 5, we noted that most of the capabilities that existed were at the national level. So this result that we see here depicts it that these capabilities that we had, even at the partially ready level, were mostly at the national, and the sub capabilities were very, very, very minimal. So we had to set a target of 80% moving into our improvement plan. So next slide. So this is just a snapshot of what the improvement plan will look like. So we, based on each capabilities and sub-capabilities where we identify gap, we also identify them, we bring them here in the improvement plan, which is also part of this checklist. That's one beauty of this tool. You will not find many other tools out there that will also guide you on improvement plans. So this is one useful component of the tool. So we did a thorough improvement plan. We follow the gaps that we identified there. We indicate timelines, and we also indicated indicators to monitor. It's not part of the tool, but we decided to adopt this and indicated a column for indicator so that we know we'll be tracking progress over time. So we want to be accountable. So we set indicators. So this is just an example of how the improvement plan may look like. Next slide. So we documented the gaps and also immediate actions that we are taking based on also what the capabilities that we identified. One of it was lack of the partner mapping. We realized most of it was mostly at the national and unstructured. So we defined also the need for partner mapping at the national. So we had a coordination team, which you see as part of in the subsequent slides on the achievement. And also we establish roles and responsibilities as action to address this particular gap. And we also see a huge need for stockpiling, which the tool was also very clear about. At all time in readiness or in response phase, there should be a stockpile ready for push into the health facilities or for the response mechanism. So we went on to do needs assessment also to understand. In fact, part of it, we have to reach again to the HQ team to share with us they shared with us estimator, a calculator to estimate PPE consumption or PPE use for MPOX. So which was also part of the actions we documented from this exercise. And we also encourage resource mobilization across partners for addressing the gap of stockpiling of PPE. And lack of specific guideline, I mentioned there are no guideline, healthcare workers, the response teams, most people were not sure of what to be done in terms of IPC and WASH. So we went on to develop IPC guidelines and also disseminate and train health workers. Next slide. And for the training also, we realized that even though IPC training is being done in previous years or so, but there is a gap between the knowledge of understanding on precaution measures and specifically for IPC focal on how to address issues of MPOX in the health facility. So we also noted the need for having a training package. So this was also a support we also got from the HQ team, which shared with us already a training package that was designed for MPOX on IPC and WASH, which we also contextualized and implemented. And we even, to some extent, got some external support from organization like the UK Rapid Support Team to support training in Sierra Leone. And the need to improve IPC assessment, yes, we realize that. So we also enforce periodic assessment to specific health facilities within the hotspot communities, which we define as designated health facilities. and lack of mechanism for data collection. So this was a huge problem in terms of the surveillance of healthcare-associated infection and occupational exposure among health workers. We thought the need for us to have a document guiding practice around healthcare-associated infection, and also to standardize data collection tool for inpatient monitoring. I'll speak to that again on specific action that we were able to achieve on this area. And this was not very clear as part of the tool, but also inside from the tool, we realized we need to have community intervention, which also largely around IPC and WASH, specifically as the epidemiology moves. We know from young people and school-going people, we realize need also for targeted intervention in schools and other learning institutions. So those are all insights we got from the tool. Next slide. So this is what we got. Throughout the phase of the response, we realized again we need to do a follow-up assessment 6 months later. We prepared in June, and July we completed a follow-up assessment. This was particularly important because we had planned in August to do our interaction review. So we need to also do an internal interaction review within the IPC pillar in readiness also for the interaction review for the entire response. So this is what we got. We compared from the initial readiness assessments, which we had 59%, in which only 9% of our healthcare facilities were then ready, to what we got in July, 85% overall, a difference of about 26% increase. And by this time, we had about 81% of our healthcare facilities were now completely ready or already in place of responding accurately to MPOX in terms of their capabilities. So we are seeing massive increase in area of coordination, even at the district level, that is a sub-national level, because the initial assessment we viewed was most of the capabilities were based at the national level, but the sub-national, which are the district and health facilities, were in large disparity. So we see now most of the capabilities are now descending to the sub-national level, and the sub-capabilities have improved. So on total, initially we have 4 that we are not ready by then, and for currently or the recent assessment, we had only 1. And this one that was not ready was one of what we had also planned, which is to conduct simulation or exercises at either at the national or health facility level for MPOX. We are still yet to achieve that. So you see that is what we still have as something to tick out from red to at least orange or yellow. So we see massive improvement also in training programs, but also in IPC surveillance, we have improved on assessment as well. So generally, all of the 6 capabilities we have improved, and they are now within the targeted range that we set, which was 80%. And at least all of them, except for the assessment, which we have limitation in conducting the WASH fit assessment. That's the only limitation we had at the moment to achieve in terms of assessment. But all the other capabilities has improved from the baseline to what we are seeing now, and mostly they are above the 80% target that we have planned across all capabilities. Next. So the follow-up assessment and key achievements we documented. For coordination, we are able now to have sustained IPC pillar coordination mechanism, which is at the national, but also weekly engagement with IPC focal. So most of this, we're able to address most of these gaps now, since we're able to have frequent engagement and coordination meetings across the different level, national and sub-national. So most of the gaps we are able to know and address. And for the readiness plan, first of all, the findings we generate from the initial assessment at the response phase. In fact, that was what we brought. The improvement plan was exactly what we brought on the table when the national response team had requested for all pillar to set up incident action plans, pillar-specific incident action plan to actually contribute to the overall response incident action plan. So exactly what we got from this assessment in the response phase is what we also brought in improvement and suggested actions. So the tool has been very much useful for us to elaborate or support the incident action plan for IPC. And for the search capacity also, we evaluated, we saw through the capacity, we were able to get even IPC personnel that are being deployed in field to support the overall response, which also we think it's an achievement along this side of search capacity. And the stockpiling has been there continuously. We go back, we review. Continuously, we keep having supplies being replenished from the national, but also at the district level, district incident management level. For SOPs and guideline, we developed a comprehensive IPC guideline, and thanks to the team at HQ, especially for April, who actually provided detailed support also in this front. So we had a full guideline that supports for IPC and WASH that covers health facilities and also community settings for MPOC. So this is one great achievement we are really proud of. Next slide. So in terms of training, we had been able to do a training of trainers at the national level. Over 700 IPC personnel were trained and who went on to also do cascading training. And this is also based on what we had developed, like the guidelines and even the training manual that was developed, a training package that was developed also based on what we noted from the initial assessment. And also we engaged some other entities like schools and community people to also conduct training and also provide provision of supplies for them at the schools and universities. And for assessments, there has been a continuous IPC evaluation for health facilities, but we even also adopted home-based care checklist, which we initially intend to use during home-based care. And also we did a follow-up assessment. So the assessment component or capability on this front has been also very encouraging. And finally, IPC surveillance and reporting. So for this one, we noted the need to have IPC or healthcare-associated infection surveillance. We documented, for now, we have documented and still looking for over 50 cases of health workers infection. So there has been a lot of rumors and assumptions as to how the healthcare workers get infected. So within this tool, there are components that speaks to healthcare associated infection. So we had suggested to develop a protocol for investigation of healthcare associated infection. The protocol has been developed and approved, and now we are getting started to conduct the surveillance among these healthcare workers. That is also something I intend to share with the colleagues at HQ. So another part of it is to also investigate healthcare associated infection among hospitalized patients. So we noted the associated morbidity or mortality currently for the MPOX, hospitalized MPOX patients. Most of them had been also, they have isolated resistant organisms from them. And an assumption is that also most of these patients are acquiring healthcare associated infection when they are being hospitalized in the MPOX treatment facilities. So we have also developed a guide, a protocol also to surveillance healthcare associated infection among hospitalized MPOX patients in health facilities. So this is also work that is ongoing as well. So these are all effort that stems from, insight that we got from using this assessment tool. Next slide. So finally, we want to share with you our reflections on using this tool. We realized that timely decision on the use of the tool in the first place by the national and also stakeholders is very much important. If you are in the phase or you're approaching preparedness or readiness, you should consider also using this tool. And if you are within the response phase, so the tool is very flexible and adaptable, one that you can use across all the 3 phases of emergency response management. So we also realize national stakeholder and acceptance, and also partner involvement in the assessment, ensure the tool to be more objective, more objective in its application. And also they will tend to trust the result that you get, but also the partners will also want to come and provide support where necessary, because they were part of the initial, planning and also execution of the assessment. And feedback of the findings, having these results are really brilliant ideas, but keeping them will not make any change. But for instance, we are able to share this result, the national IPC focal points, through the incident manager during the initial phase of the response. I had the opportunity to present the result of the assessment to the incident management team, and all of these gaps were identified. Also, we are brought onto the incident action plan for mpox response for IPC. So we're able to make some significant change around addressing those gaps. And also follow-up assessment is necessary, like Hamoud said. We also want to track the progress and to know whether you are there, you have achieved. And if good, also you can set targets to within the next 6 months, what percentage you want the capabilities to be at, and you work towards those. And when you also set the actions, they should also be action that are very much linked to the gaps. So the actions should be able to address the gaps. Otherwise, if you develop action that will not address those gaps specifically, then you invest in resources and you will not get again the result that you want. So continuous assessment and redesigning or reviewing the action to see whether they address the gap is also a very important aspect to consider. And also the tool, I believe it incorporates all relevant field experiences. For instance, after our initial piloting of the tool, we had provided some inputs to the HQ team about what we think and what we believe can be modified, and for it to be more relevant and more applicable to different settings, like some of us that are in resource limited settings. So these are what we believe are key reflections we would like to share with you. Next slide. So thank you very much for your time and your attention to this. So this picture here was the initial discussion we had last year during the Geneva meeting in August, where we started the discussion around the use of this tool. And thank you very much. We would like to appreciate also the efforts of the National IPC program in Sierra Leone for their leadership in this effort. Thank you. Over.
Thank you very much, Bobson, for the very comprehensive presentation of what you've done in Sierra Leone. And it's great to know what was done on the ground, what the challenges and issues were, and especially the lessons and looking forward, which I'm sure would be very helpful to everyone here who wants to move forward. I would now like to invite Dr. Alphonsine Mukamumnana from Rwanda to present. I believe she's had some issues with some technical issues. So can I request Mahmoud to please support here with her logging in? And just one more thing before she speaks, I notice on the chat, many of you have asked for certificates. We have not been giving EPIWIN certificates for a while now. That's because we are an extremely small team. All of us have many other responsibilities, but we believe passionately in EPIWIN and we try and keep it going. But EPIWIN is a knowledge translation, knowledge sharing platform where we would like you to learn about what is happening in various areas of public health emergencies and actually find practical ways of doing something on the ground, learning something. So I do hope that even without the certificates, you find value in EPIWIN because of the content, because of the speakers, and because of your question. You can ask questions. And I hope you will continue to join us, even if there are no certificates now. And of course, once the situations changes and we do have the capacity for certificates, we will certainly revisit it. But for now, we do not. With that, over to Alphonsine, please.
So Priya, could we
Yes.
please go to the question and answer and discussion? Currently, Alphonsine has technical problem, and she will try to join us after the discussion.
Okay, we go over. So over to, I would like to invite Anthony Twyman and Omar El Khattab to moderate the question and answer session. We will get back. Alphonsine, as I said, is having some technical issues. So when we can, we will get back to over to the Q&A.
Anthony, I think most of the WASH questions have been responded to one way or the other, but the bulk that is in the health domain. So over to you. Thank you.
Yeah, no worries, my friend. Good afternoon, good morning, everyone. Anthony Twyman here with the UK's Public Health Rapid Support Team. And there are definitely many questions, so thank you for attending to the overarching around the materials. I see that the link has been popped in there for everyone asking about the presentations and where to find it. So that's in the chat, but also directly to some of your questions. I did just maybe want to pick up maybe first with Mahmoud, yourself, and April, and then I do have something here for Bobson. But maybe what could be helpful, there are a number of questions still coming up around the setting types and where exactly you can use the Hero Cape checklist. So I think maybe just some clarity around, is it really appropriate for facility level? And if so, could you designate what types of facilities? And also, how do we think about application of the Hero checklist and maybe sort of other kinds of modalities of healthcare delivery? So mobile clinics, or maybe the makeshift clinics, even in IDP camps, things like this. So how do we approach those different kinds of contexts using the Hero Cape checklist? So maybe Mahmoud, over to you first on this.
Thank you so much, Anthony, and thanks for this question. So I was, as I was saying, it's a national, subnational capability assessment checklist. So this is the idea from the Hero Cap tool to check our country ability to respond to public health threat or an outbreak. As I mentioned, there is a capability around the assessment. So we are asking about if you have an assessment system in place. And also we have two other sub-capability asking about the completion of the assessment, IPC or WHOOSH, or both together in the health facilities. So as I mentioned as well, that it's ideally to use jointly with a appropriate health facility assessment tool once you identified an imminent risk or threat. So for example, as Sierra Leone mentioned, that it was used, the Hero Cap tool, to identify the gaps on the system level, on the national level. And it's also, they used the rapid assessment tool to assess and capture the IPC observation and action implemented at the health facility as well. I hope this example clarified. Over to you, Anthony.
Yeah, thank you so much, Mahmoud. I think that does add some clarity. And given, like you were just saying about Bobson's presentation, how they started at the top to identify going down, I think that kind of approach can work well, probably in many places, but it seems like you need to be informed and know where you're going to make it most appropriate. Maybe what we can do there is actually, Bobson, if it's all right to come back to you, there was a specific question raised with regards to surveillance. And I see some other questions here around what big challenges did the Hero Cape help you really overcome specifically, and how can that work in maybe other low resource areas? So I don't know, Bobson, did you want to maybe just use the surveillance example within the Hero Cape sub capabilities? as maybe one of those big achievements, or maybe there's another one you'd like to elaborate on. But maybe if you could just speak to what was a big achievement specifically addressed because of this tool that you think other colleagues here on this webinar would benefit from hearing, and maybe just how did it help you solve those barriers? Over.
Yes, thank you very much, Anthony. Yeah, I think a big achievement I like to share is again on the surveillance. We had got a surveillance strategy for healthcare-associated infection for routine, as part of routine process of surveillance in hospitals. But we never thought of doing surveillance of healthcare-associated infection, either among mpox patients during outbreak or among healthcare workers who got infection. We never saw that coming, so we got stimulated by all of this when we saw this within the tool. I think, okay, we should start thinking of surveillance system whenever there is an outbreak. And if we get started for this, I think we can be able to be more adaptive to every other outbreak. Sierra Leone is a country which is very prone to outbreaks. So I think the intervention around healthcare associated infection surveillance, either the one that has to do with the health workers infection, which we are now investigating. And I'm glad April mentioned about the example of DRC, I think, concerning the Ebola. When the outbreak is going down, but you also notice issues of healthcare associated infection or healthcare outbreaks. So I think these are things we believe are really good achievement besides every other progress we have made concerning the outbreak itself. Thank you. Over. Sorry, I'm in the field, so you get some feedback from the background. Thank you.
No stress at all whatsoever. No, and appreciate that. And I think that's a really nice way to exemplify maybe the power of the hero cape, or sometimes it can also just be when you take on different kinds of assessments, you get different people around the table, and this kind of checklist does bring that collaborative approach and gets people to also be thinking about areas and aspects of IPC implementation that maybe aren't necessarily at the forefront. So also very good. I think if I can maybe just come back, and I know, April, you did answer one colleague's questions on the webinar around which phase this is most purposeful for in terms of readiness and response. But maybe what could be, there were some other questions that have come up around how is the Hero Cape complementary to IPCAF, IPCAT, WASH Fit? Where exactly do these things fit in? And so I don't know if maybe from yourself or Mahmoud, if you wanted to comment. I know that there was expression around still using IPCAF and IPCAT, depending on what you're looking at, maybe more in the preparedness. But maybe if you could just touch on the complementary nature, and Bobson, of course, maybe perhaps come in to sort of speak to how this works in practical terms. But all of these tools are not meant to be replacing other tools, but in essence, they are working together. So I don't know if maybe we could just unpack that a bit more for the audience. I see Nasheen has raised her hand, so I'm not sure if you would like to speak first, Nasheen. But Mahmoud or April, I open the floor for yourselves.
Let me go first, and then Mahmoud and Nasheen, because she can speak particularly to WASH along with Omar. So thanks, Anthony, and thanks for that question. I think it's a really important question. And the take-home message is that no, this should not be replacing other assessment tools, in particular the IPCAF and the IPCAT. I think that is why we were showing at the beginning of the presentation around the framework, the different phases, because depending on what phase the country is in, and depending on what level you're speaking about, if it's national or if it's facility level, then you would use a different tool. So it can be quite complex because there are different types of tools, and we appreciate that, trying to streamline it, but at the same time also appreciate that For specific pathogens, you might use one type of tool, and when you're in the response mode, you need something that's quick. So the IPCAF and IPCAT are more programmatic and really around strengthening the health system from an IPC perspective, programmatic perspective. But if you're then suddenly in an outbreak setting and you need to do a rapid assessment at a facility that you haven't done before, then you have the opportunity to use some of these other tools. For example, the rapid assessment tool for Mpox and for Ebola. But the HERO one is supposed to be done at national, and it's more in the context of with an imminent threat. But I'll hand over to Mahmoud for that, and then Nasheen. Thanks.
Thanks, April. I think you answered the question very comprehensive. Over to Nasheen, if you have any compliment.
I think
It's okay. I will respond. So, for the watch fit, it addresses. It can be used at all levels of the health facilities in any stage. So, whether it's from preparedness, or you can also use it for response phase and modify the questions according to the needs. So it can be adopted at any levels and any cycle of the emergency response. And there was a question on the primary healthcare facility. So WashFit can be used for primary healthcare facility as well. So that's from my side. Back to you, Anthony.
Yeah, thank you so much, team. And I think too, all of these tools, they have different granularity too. So I think some of these more specific ones, like April was talking about with the IPCAF, IPCAT, and Nasheen mentioning WashFit there as well. I mean, the level of detail that is there is much more. And so, things do have to fit the context. So this is also why we see the Hero Cape now. So thank you for adding that clarity. There are some questions. I'm not sure how we are on time, so I'm happy to hand back in a second here. I did just want to end on a couple quick things. One was around language availability, so not just of the slides, but of the tool itself. So if there are other languages available, I'm not sure if it was mentioned or not. And maybe Mahmoud, if you could just touch on, there were some questions around people's interpretation of the generic assessments versus disease specific, and maybe just to highlight what kind of differences those would be. It doesn't seem to be clear for all audience members. So over to you.
Thanks, Anthony. Sorry to jump in here before I ask Mahmoud to respond to your question. You're right, we are well out of time. So if we could wrap up the Q&A. And we did have in the agenda Dr. Alphonsine from presenting as well. And if at that time there were tech issues, but if we can now, we would still like him to present. So with that, over to Mahmoud, and then if you could wrap up, please.
Thank you. Quickly to answer your question, Anthony, currently it's urgent English version, but in the pipeline to have it in Spanish and the French as well. The big difference between, or not the big difference, the main difference between the general assessment and the disease-specific one, that in the disease-specific one, we are asking about the two sub-capability about the completion of the assessment, where I mentioned that you need to use a health facility assessment tool to assess the readiness at health facility level against this disease or public health threat. While the general one is, we are dropping off this two sub-capability about the completion of the assessment at health facility. Let's try now to check Alphonsine. Alphonsine, are you with us? Could you present? Alphonsine, are you able to hear us and present, please?
We can do the presentation for her, Mahmoud.
Yes, I'm hearing from you.
Okay. Okay, go ahead.
Can I? Okay, thank you. And I apologize for the inconvenience happened. I was not, I don't know what happened with my devices. So good afternoon, everyone. My name is Alphonsine Mukamunana. I'm an environmental health specialist in Ministry of Health, as well as IPC focal point. So I'm going to present to you the country experience using IPC and the WASH Hero tool checklists. Do you get me?
Yes, please, go ahead.
Okay, that is great. The infection prevention and the control situation analysis during Marburg outbreak in Kigali, which was happened in 2024. As the Minister of Health, we requested the WHO to assess our IPC and WASH readiness during this emergency by using this HERO checklists. So as a background, the national team from Rwanda expressed the interest to pilot the IPC WASH HERO checklists to assess the national capabilities for viral hemorrhagic fever, particularly Marburg and the Ebola virus disease. And the virtual meeting was held in September with WHO team headquarters. And 1 week later, the Marburg virus disease outbreak declared in Rwanda on the 27th of September 2024. Any urgent situation analysis was conducted by using this tool that I'm talking about, the HERO-1, in October 2024, after the 1 week of response. So the goal was to identify strength, area for improvement, and provide actionable recommendation to enhance IPC and WASH capabilities for response to MVD. The other goal was to evaluate the coordination mechanism in place, a readiness plan, guideline, training, facility assessment, as well as the surveillance and reporting system. Follow-up assessment was conducted in November 2024, after the Marburg is over. So the first result of assessment, so we scored less, like 60%. So there was areas where we have a strength, like coordination mechanism, readiness plan was in place, but we have some issues in the guideline, SOPs, and the standards. In training, we scored 67. And then in the assessment of health facilities, we scored 50%. And then other gap was in surveillance and reporting program, where we scored 44%. So in a brief, after this assessment, we know where we have a gap and the area where we can improve and where we have strength that we have to maintain. So after the assessment, so there was some findings and action taken. As I said, so our we have the weakness in the guideline, the SOPs, the training program, assessment of health facilities from tertiary level up to the primary level, and then the surveillance and reporting system, so was also weak. From that identified the gap, we developed some action to implement. So during the Marburg, so we have started developing the guideline and the SOPs for Marburg, where 19 SOP, one guideline for Marburg and 19 SOPs have been developed, reviewed by team of experts, and then finalized. So waiting for approval by Ministry of Health. So the dissemination of some guidelines have been take place and its implementation. So for the training program, so we have trained the mass for healthcare frontliners during the Marburg by taking 3 days or 4 days. So, but we train the much as we can so that the basic IPC measures.
Can you please, sorry, Alphonsine, move the slide, next slide, please.
Next slide, okay.
Yeah, and this is the, sorry, I'm speaking to the technical team. Yeah, we are here in the slide for the post-assessment findings and actions. Yeah, go ahead, please.
Okay, great. So we have involved the partners. We engage them, especially in coordination and in validating some documents. So we form a team of experts from WHO, MOH, and the other partners, as well as the NGOs that they have some intervention related in the IPC and the WASH. So we engage the academician as well as referral and teaching hospitals. And this document, the IPC guideline, the IPC policy, the IPC strategic plan, training material, 26 SOPs. So we develop other SOPs that we found it is needed. And all of these SOPs have been trained. Here is a
Next
photo
slide,
that's taken
please.
during the MABAC. So with different stakeholders in this consultation of the document.
Next one.
So yeah, the next one. So the National Operation Guideline have been also developed. This guideline, it is now under approval process. And then the SOPs that I talk about, it is here mentioned. And then after the MABAC, we continue to strengthen the training and capacity building of our healthcare facilities, as we have a MABAC and we don't know if it cannot happen again. So these people, almost 3,000 people have been trained in the 2 months, including the Director of Medical and the Area Health, Director of Nursing and Midwife, Chairperson of IPC Committee, Environmental Health Officer, and the IPC focal point at the secondary and the tertiary level. So for the primary health care, we train the manager of the health center and the community health and the community and environmental health officer. So here is the photos that showing taken during the summer trainings. So
1 minute,
the
and full scene.
yes,
I'm asking the technical team to move to the next slides. Yes, this is what the recommendation and SOPs. Next one, please.
We are together?
Yeah.
For the second assessment?
We finished the training at all facility level. Second slide, the pictures.
Yes.
Yeah, this is pictures of the training activities, simulation exercise, and AB shuttle 1 and surveillance team. After the next slide, please. Now we are in the second assessment, Alphonsine, in November. Yes.
This is where I am.
Yeah.
Where I am.
Okay.
Okay. So for the second assessment was conducted in November 2024, and where we have a gap from the first assessment, so we have increased a bit, like in the surveillance and the reporting. So there was a lot of gap, but now we increased up to 8%. And then the assessment we have increased to training program, we increased up to the 8%. And now the gap was remaining in the guideline and SOPs, which was not signed. But after that, some documents have been approved and signed. So from the first assessment to the second assessment, I think it was
second slide, please.
For 1. Yes, the 1 week, the 1 month. So we increased up to the 10%.
Yeah.
So as the key recommendation, we have to continue to stress. Second one?
No, you are okay. Go ahead.
Yes, please. So as the key recommendation, we have to continue to revise and validate the remaining guidelines so that they can be disseminated. So the health facilities assessment will continue to be conducted. So currently we have conducted the assessment in 53 tertiary and the secondary level out of 56 health facilities. We are remaining with a few, and the plan is ongoing for the assessment of health centers, means the primary health level, the healthcare facilities. So the capacity building is also ongoing. So we have to put much effort on these 4 pillars, if I can say. So here is the example of some approved documents. We have developed the Rwanda Infection Prevention and Control Policy and its implementation strategic plan, which was started in 2024 and will end in 2029. So as a conclusion, the findings of this social analysis underscore the practical utility of WHO IPC WASH hero checklist in a systematic identify the gap and monitoring progress during the public health emergency. So strong capabilities, well existing in coordination, readiness, simulation exercise, before the outbreak, and the significant improvement done during the response in the training program, hospital surveillance system, and the priority facility readiness to respond, reflect targeted effort to strengthen outbreak preparedness. So, however, persistent area for improvement in the guideline and the facility assessment highlighted the need for sustained investment and the capacity building to ensure comprehensive IPC WASH readiness. So this action will not only address current challenges, but also enhance Rwanda's capacity to respond to future public health threats, safeguarding public health and resilience. Thank you very much.
Back to you,
Thank you
Supriya.
very much, and I'm very glad that
Yeah, I finished to present.
Thank you so much, Alphonsine.
Okay, thank you very much. Any question? Any clarification?
I think we are fine, and we already running out of time. So back to you, Supriya. Thank you for that.
Thank you very much. Thank you. And I'm glad we could have that presentation in spite of technical difficulties. But as Mahmoud said, we are running out of time. So over to you, Janet.
Amazing. Thanks, Supriya. And I want to start off by saying thank you to everyone. Thank you to our speakers, especially the colleagues from Rwanda. Alphonsine, who I know had some difficulties getting on, but your presentation was outstanding and really highlighted some important things. And also obviously to our colleagues from Sierra Leone, Bobson, who was able to share as well insightful experiences from the Sierra Leone experience. So big congratulations really to them for the outstanding work and to the teams at the country for what they have accomplished and done. And I also want to give a big thanks to the audience. The Q&A session was actually really, really great. You really asked important questions for clarifications, and so thank you for that type of engagement. What is important here, there was a few things that I thought were I wanted to emphasize or re-emphasize from the talks that are in the most recent discussions. It was to really ensure that the tool is grounded in real world needs and real world realities. And what I learned, and I think what we all know, is that really needs to be done in a timely fashion. I think both experiences, Sierra Leone or Rwanda, literally doing it just before the outbreak started was quite telling. So, and how that can be so useful. The other aspect was about really using that improvement plan function that is in the toolkit, and how, and setting a target could also be really helpful. And then most importantly, that the tool needs to lead to immediate action. And I think the example shown was really about how taking action based on the assessments really led to change. So what do you take away from this? The HERO checklist is more than just a tool. It is really a framework for action. And I think we've seen that very well displayed. And of course, by systematically assessing IPC and WASH readiness, countries can better prepare for and respond to health emergencies, protecting patients, communities, and health workers. So we encourage all participants to explore the HERO checklist, available on the WHO Partners platform, as you were told, and use it in your national and facility level preparedness and readiness planning. We are also happy to receive feedback and lessons learned, because that will help us refine the tool, adapt the tool for broader use. So quickly, just to close the event, I want to thank EPIWIN team for hosting today's session, and to our moderators, Anthony, who did a wonderful job moderating the Q&A. I also want to give a big thanks to the people behind the scene, the technical WHO, IPC, and WASH team for getting this all together, and specifically to Dr. April Baller and Mahmoud Hamouda, who gave the presentations and worked hard in this preparation, and for the administrative support of Michael Tabizeski, who was helping us also prepare. This is really part of a WHO's ongoing commitment to strengthening global IPC and WASH capacity in public health emergencies, and to the delivery of safe and scalable care, be it during an infectious disease outbreak, a humanitarian crisis, or a natural disaster. So I will hand over to the EPIWIN team for their closing remarks, and we do look forward to seeing you at our next EPIWIN webinar for continuing this important dialogue. And before I say over to you, Supriya, thank you again to everyone for joining us. Together, we can make outbreak response safer, more effective, and more scalable. And I wish everyone the good rest of the day or night. So over to you, Supriya, and thank you.
Thank you, Janet, and thanks to Janet for leading this work, and April and the whole team. I'd also like to thank our partners here, Project ECHO, particularly Sangamitra, who's been working in the background, sharing this screens, and helping this webinar to. Thanks most of all to all our participants who are part of the EPIWIN family, as I like to say. I hope we can see you next time, and to let you know what we have coming up for the next EPIWIN. Can you see that? It's introducing integrated outbreak analytics. We're back on Wednesday next week, and I hope you join us next week. And of course, we look forward to continuing to collaborate with Janet and April and Mahmoud and all the wonderful panelists here for IPC and WASH in future. And we will let you know when. So watch this space. Thank you and have a wonderful day and a wonderful week. Bye.